Hello, everyone. Let's discuss the language of anatomy and physiology for Tuesday's warm-up. So, same as Monday, let's use our common names to identify these anatomical landmarks. Let's use what we would maybe call them before anatomy to talk about what they're called in anatomy. So, an anatomical position, this person's foot, this is the anterior of their foot, and the anterior aspect of the leg is called the crural region. This right here, your tibialis anterior, the front of your leg, where right above your toes, between your ankle and your knee, between your tarsal and your patellar, that is called the crural, the anterior, the front. Tarsal, as you may have guessed, is your tarsals, your ankle region. Tarsals are the bones that make up your ankles. So where your crural meets your dorsal, that's your tarsal. And then gluteal, you guessed it, that's the gluteus maximus, the buttock, everyone's favorite anatomical region. I can hear you giggling now. So the anatomical region of the butt, the buttocks, that is the gluteal. All right, cephalic, that is your head. Cephalus, your head. Cephalic, the whole head, not just face. There's a bunch of different regions on your face, bunch of different regions on your skull. The whole head, that is cephalic. Then popliteal is the opposite of your patellar. So it's your knee pit, the posterior knee area. So anterior or front of your knee is your patellar, named after your patella. The popliteal is the posterior surface of your knee. Coxal, it's coxal, not coccyx, coxal, named after the bone, the coxal bone. So this is where your pockets are. If you have pockets in your pants, it's where you put your hands when you put them in your pocket. You're touching your coxal region. So it's the lateral most region. So it's named after these bones right here, the coxal bones. You have a right coxal bone and a left coxal bone, the ilium, ischium, and pubis. The buccal, this is your cheek area. These muscles are called the buccinator. They help you buccinate. They're your cheek area. Then antebrachial, that is your forearm. So brachial is your arm, like your biceps brachii, triceps brachii, brachial artery. The antebrachial is further down. That is your forearm, the antebrachial. And then sural, that's the opposite of crural. So crural is the anterior or front of your leg. Sural is the posterior or back of your leg. So below the popliteal, above the tarsal, that is your sural. Below the patellar, above the dorsal, that is above the tarsal, that is your crural. So crural is anterior, sural is posterior. Okay, good luck.